Our speakers today are Rhonda Roper and Cheryl McClain. Rhonda serves as BrightView's Vice President of Quality Operations.
Ditto, Rhonda, in appreciating the time that you're taking over your lunch. Hopefully you're getting a bite to eat while you're listening to this and learning a little bit of strategies and what to look for going forward. So Rhonda did a great job of talking about the compassion fatigue. Well, what is burnout and how is that different and what do we look for? So certainly that's part of compassion fatigue. It can be associated with that. It can exacerbate both. You have one, you have two. It can certainly make things more difficult for you going forward. Really, these things are quite complex. And as Rhonda mentioned, you're going to maybe be feeling exhausted, depleted. You just have nothing inner to give. You're going to feel like you're overextended, and you're going to start to depersonalize. You're going to not show attachment or feel the same things that you have felt before. You might have some emotional distance again from your people that you generally want to be with, and the work group, family, that sort of thing. You might have feelings of, I'm not doing a good job. Why am I doing this? Why do I have that sense of reduced proud of, being proud of what you're doing, or that professional accomplishment. So all those things kind of lead in and can give you some heads up. So as Rhonda mentioned, the sooner that we know this is going on, we want to know about it, and you want to know about it, and you want to act on that. Neither of these are a medical or mental diagnosis. Now, certainly, as Rhonda mentioned, they can be together, and we see that a lot. One leads to the other: the anxiety, the depression, and those things do need to be addressed and treated medically if those are occurring. Next slide, please. So to continue on, burnout is distinct, as we mentioned, from the mental health disorders, but certainly can be associated with that, and the general stress associated with it, the job dissatisfaction, the secondary trauma associated with it, and then it can certainly be associated with that compassion fatigue. So burnout is more of a stress related to what you're experiencing currently in your life. And there are some strategies that you can do to help that. Again, these things, there's not one thing that shows burnout. There's not one thing that shows compassion fatigue. There's not necessarily one thing that shows depression, anxiety. They can all co-occur. And it's very important, if you see any of these symptoms, feel them in yourself or with a colleague, family member, this certainly goes beyond work, then help reach out and talk to someone. Next slide, please. What's the difference between burnout and compassion fatigue? They're very related, as we mentioned, but compassion fatigue is generally that exposure continuously. We're listening to perhaps a suicidal patient over and over. We're listening to patients who have lost custody of their children. We're listening to just the traumas that our patients have experienced in the life. So you're living that with them in that moment. And as that goes on and on over time, that becomes more emotionally difficult to manage. So it can be with the impact of helping others as well. And if you get to that early, we're going to see a quicker recovery. So the burnout is generally, as we mentioned, work-related, attributes to certainly toxic work situation, the culture at work, a supervisor that perhaps you might feel like they're out to get you. Certainly I've heard that before. That makes that toxic culture. This is gradually, and it deals with the lack of resources as well, describes the impact of a stressful workplace. and it takes longer to recover. So I do want to go over to that compassion fatigue real quick, and generally do, when you read about this, and perhaps Rhonda can remark on this as well. So the compassion fatigue might be a little bit quicker onset. It can happen much quicker than burnout. It's sort of a give and take. Again, there's some symptoms that cross over. If you're experiencing any of these, then we certainly want you to reach out. And next slide, please.
Yeah, I definitely agree with that, Cheryl, just in that, thinking about compassion fatigue, I always think of it as being sort of a warning sign to be on the lookout. Burnout may be occurring. And so the quicker we can recognize that, the more we can use some strategies and things to try and get a handle on that for sure. So, we've looked at just the differences in those two terms and kind of how they play out, but let's also just talk about how these things affect us. And I think the key word here is they affect us universally, right? When we're experiencing burnout and compassion fatigue, it's also impacting at a higher level. So thinking about as health workers, we see that playing out in terms of, we may become unhealthier. Engaging in more isolation, substance use may set in, those, mental health symptoms that Cheryl had mentioned, anxiety, depression. We may see this playing out in relationship issues. One of the things I often see, with individuals is that they may be taking work home. You've been at work all day, you've had some negative experiences, you may just be feeling overwhelmed, and then you talk about that all evening in your relationships, right? And that will be okay for a while, but at some point that can become, too much, and certainly could lead to relationship issues. Interpersonal challenges can occur, difficulty sleeping or insomnia, and even diabetes. And where does that come from? Cheryl, you chime in here, as well. But, when we are experiencing these things, we typically aren't doing the best job in taking care of ourselves. And that typically ends up looking like a lot of eating out, or not eating healthy, or not eating as much as you should. Engaging in, unhealthy snacks, candies, all of those things, right, that sometimes become comfort foods. Also, our patients are affected. We see that playing out in terms of, spending less time with them. It may be that, when the compassion fatigue and burnout is occurring, we're having difficulty, continuing the sessions for the full length, or the appointments with our patients. There may just not be as much desire to engage in those meetings, or having that sort of clouded judgment from your compassion being lower, you may not assess and, be able to identify the needs of the patient as readily as you would had you not be experiencing those things. It can also lead to delays in care and diagnosis if we're not as effective or as focused in our sessions, right? Or our appointments. It may take more meetings with our patients to be able to assess and, develop a plan for whatever their needs may be. And therefore leading to potentially a lower quality of care. And then medical errors, errors in documentation, and, errors in, medical prescribing, errors in even diagnosing, and treatment planning for patients as well. That list goes on and on. It also can affect our healthcare system. And so we're seeing this, I think, nationwide in terms of the pandemic with COVID certainly led to increased burnout and compassion fatigue, just due to the stress from that pandemic itself, and then not to mention the increased workload in the healthcare system. But ultimately that can lead to healthcare shortages through difficulty finding people to do the job. One of the things we continue to see during the pandemic, a lot of recognition for how difficult healthcare work is. Most of us have always known that it's difficult, right? But there was a lot of attention for that because it was even more difficult during the pandemic. And so it's definitely made, hiring and in some ways, potentially decrease the number of individuals interested in the field. Can lead to retention challenges, limited services being available, risk of malpractice, decreased patient satisfaction when we're not as in tune with their needs or not able to give them our full attention or our full professionalism. It definitely impacts their satisfaction as well. And not to mention increased costs just through the impact that can have on the healthcare system. And then looking at the community level, it can lead to increased health needs in our population. If the folks that are treating the needs in our communities are dealing with burnout and compassion fatigue themselves, therefore impacting the work that they're doing with the patients, then that can trickle down to the wider population as well. It can lead to an erosion of trust. I'll speak on that for just a minute in terms of our patients or individuals that we're helping or treating or seeing, depending on what work they're doing, they may not be aware or understanding, how difficult your caseload has been or how difficult your day is going, or the fact that you're dealing, with compassion fatigue or burnout symptoms. And so if they're not seeing, you giving your full attention to them, it can lead to that erosion of trust for sure. And low expectations. And then a lack of preparedness for public health crises. We can certainly see that in terms of just some of the difficulties we've seen with staffing positions, like physicians, nurses, counselors across the country, just based on some of these things that have already played out in our community. Next slide.
Yeah, actually, let me horn in there a little bit. If we'll go back to that slide. So, these are each buckets, right? We've got the health workers, we've got the patients, we've got the healthcare system, the community. Think about that. All of us are in each of those buckets. These things that we're talking about, the compassion fatigue, the burnout, all those symptoms how can you tell one or the other? How can you tell when it becomes, I'm depressed? How do you know when there's medication necessary? How do you know to take those next steps? I think the biggest thing to take out of this is to ask questions, reach out, and see how other people are handling the situation, see how other people see you. Sometimes, I hear things about me, you don't seem to be your normal self today. What's going on? And boy, that just makes me think and be mindful. So if we can do that for others, that's part of what we're going to kind of touch on a little bit of some of those strategies that maybe you can do. But taking care of the moment and being mindful is very important. All right, next slide.
Yeah, thank you for that, Cheryl. It definitely, it's not lost on the fact you just see the impact and how that trickles down to every level. So, this is certainly a widespread issue that we're experiencing across our communities for sure. And so, this boils down to the fact that there is a high cost of caring. Never underestimate the work that you're doing, the stories that you're hearing each and every day, the way that you're touching lives through the work that you're doing, no matter what that is. And the fact that there can be exposure to trauma through the work that we're doing, in the healthcare system. Every responder may have their own definition of what a traumatic event is. I won't take too much time on this, but I'll share. I'm a social worker from background. And so if you're in my home, you're going to hear me talking about all sorts of topics, just topics of interest based on the work that I'm doing. And sometimes, thinking about the stories that you may take home, certainly not sharing individual patient information, but just talking about how many people that you've seen experiencing a certain condition or dealing with suicide or overdose. Those are some topics that come up quite a bit. Those can be difficult for people in your family to hear about. But the thing I want to point out there is that, those have become normal topics for you and things that you're exposed to every day. And so never underestimate, what important work that you're doing, and the potential for that trauma, through the work that you're doing. I like this example here on the slide about working with children. Dealing with the things with children around mental health, substance use, child services, any of those things. We all know there's a lot of trauma involved in those as well. And so those can certainly lead to extreme or increased vulnerability for sure. And then we're responding to a call from someone that you know. Maybe it's not in the work that you're doing, but maybe you're dealing with family members or friends or people that are close to you in your life that are dealing with health issues or mental health issues or substance use. And so just the same, those experiences can be traumatic for you as well. Secondary trauma is really important to talk about in this context in terms of the fact that hearing someone else's story or helping that patient or that individual work through that situation, giving them resources or support, that alone can lead to secondary trauma. It can lead to you becoming overly watchful, on edge, hypervigilant. You'll see that term used here. And you may not realize this is even happening with yourself. So again, really good to understand that these things can occur and know what to look for. Maybe you're having difficulty scanning for threats, you're on edge, you're overly aware, even in your own home life. We see this quite a bit in individuals that may work, with the criminal justice system, police officers, anyone working in like a crisis or a trauma setting. That secondary trauma from being on edge and bringing that home certainly can be very common. Flashbacks, nightmares, again, two common symptoms to look for there. It may be that you heard or you helped someone through an experience and you're dreaming about that at night and having nightmares. Or maybe you're just having thoughts that recur off and on, at different times during your day, or maybe even in the evenings or at night when you're sleeping. And then the avoidance of people, places, and things. And again, that's a common one that we see, and we definitely want to bring that to your attention. It may be that if you're working with, individuals dealing with substance use and you've got family members of your own that are dealing with that, it may be that you see this playing out with you becoming avoidant of interacting with them, just from the fact that you've been dealing with that so much in your work or whatever that other context may be. And then vicarious trauma or secondary trauma, it can be just as detrimental as having a direct traumatic event. And so I want to say that again. It's just as dramatic. It's just as impactful if you're helping others that are dealing with these sensitive traumatic experiences. That's just as important and just as detrimental as if you had experienced a traumatic event yourself. And so you're going to see a little bit later in the presentation, we're going to talk about some ways that you can focus on taking care of yourself, just in the fact that you are vulnerable for some of these symptoms to occur just based on that secondary trauma or PTSD. Next slide. Yeah. Toxic positivity is such a great topic for us to talk about in relation to this. I think individuals who go into the healthcare system, typically you enjoy helping others. You take a lot of pride from that opportunity to listen to someone, help them, and you may get a lot of individual value from that as well. And so those traits alone can sometimes be a barrier for recognizing that things like compassion fatigue and burnout are occurring, because in some of our thoughts, right, the idea of acknowledging these things may actually make us feel like we're weak, we're not doing our part. We're bad, simply put, right? And so one of the ways that we see folks dealing with that often is through this concept of like a toxic positivity. It's part of the job. It's going to happen. I just have to deal with it. I'll be okay. It's a part of what I do. And so that's not what we want you to do. We want you to acknowledge that the work that you're doing is difficult. We want you to acknowledge that it's okay to say that you're having a tough day when you are. And it's okay to say, you know, I've been helping people all day. I just need a break right now. You know, when you get home in the evening, if you're helping others, sometimes it can be difficult to tell people in your family that, your friends, you know, whatever your inner circle looks like. So often we receive this advice just to stay positive, look on the bright side. And these things can really be detrimental to a person that's suffering from compassion fatigue, secondary trauma, burnout, any of these things that we've been talking about. So again, it's okay, you know, to feel those emotions, acknowledge those, and most importantly, understanding that you're going to have different emotions about the work that you're doing. You're not always going to feel 100% joyous and happy every day about what you're dealing with. Especially when you're working with others, you know, in healthcare, you're helping them with difficult situations. And so it's okay to say that, you know, you're having some different feelings about what you're experiencing through helping them. Next slide.
Compassion, satisfaction. Before we go on to that, I want to think about something that Rhonda had mentioned about the secondary trauma and how that is so impactful. There's also something called the second victim syndrome. And what that entails is basically maybe you're a clinical counselor, medical provider, criminal justice, probation officer, whatnot. Who you're working with has a bad outcome, say suicide, say a misdiagnosis, say whatever. And all of a sudden, you're worried about what could I have done differently? Did I not do my job? Did I, miss something? How often do we think that, we think we need to be wearing that cape and we need to have that magic wand. And sometimes we do everything that we can do and there's still a poor outcome. And so you get that second victim, which is very much like the PTSD that Rhonda mentioned. You can have the nightmares, constantly thinking about it. You have lack of confidence now. You're not enjoying things. So I wanted to throw that out there as well, because I've certainly had that experience. And I'm sure several of you have. And sometimes if you can put a name to something and know that others have experienced that, it helps you reach out, because many of us are stoic and we don't want to reach out, right? That's a sign of not being strong. And particularly the women out there, we want to come across appearing strong. You men out there as well. So in saying that, let's talk about compassion, satisfaction. So this is that what we all do this for, that sense of fulfillment that you get when you do what you were meant to do. One of the greatest things that I find joy in is when our patients, a person who is addicted to drugs is in recovery and working with the criminal justice system or the child services, that sort of thing, and they get their kids back. They've worked so hard and all of a sudden that happens for them and now they can be a family again. I take great joy in that. So this is a source of hope, strength, resilience, and purpose. We've got our purpose back. It allows you to kind of face another day. As Rhonda said, that day might not be as joyful for whatever reason, but we've got that purpose and we've got that strength from having that satisfaction on previous days, and hopefully somewhere in the current day. It's quiet knowledge, really, that what we do really does make a difference. And sometimes we just have to pat ourselves on the back because no one else is going to do it. And we should be doing that more. And that's something with burnout and compassion fatigue, really, that we need to do, is to take care of number one, because if you'll remember, every time that you fly, you learn from the stewardesses that you put the oxygen on you first so that you can help others. And this is very much similar in that. So you're going to see same strengths that you're supporting, in the survivors with whom you work. You're going to be able to have a kind of a joint compassion for that and something in common. You're probably going to be more involved in your community or things of pleasure. Not all of us want to be involved in the community, and that's okay. But all of us need to have something that brings us joy, whatever that is, even if it's knitting, if it's sitting on the porch drinking iced tea and watching, watching the sunset go down, or whatever that is that brings joy to you. And then being that connector, that bridge between someone who is helpless and getting them connected with that resource. I'm going to give some kudos out there. We've given kudos to the nurses and Happy Nurses Week for sure, but our case managers and folks, social workers, and even everyone does this, but providing those resources in the community, being aware and getting that bridge, even maybe helping that first phone call. So, all right, next slide. This might feel a little bit out of sync, but you're going to understand with the next slide while we're talking about this. So overdose statistics, we all know with this crazy, since COVID, it's just shot up, 28 to 30% increase in Kentucky. It's crazy. And, you can look at the stats there. I'm not going to take a lot of time to go over those. Basically, I just wanted to bring attention to this craziness that's going on, what we're seeing. And we're seeing this in the older population too. So that's kind of new that population has really, the 65 and over are overdosing and having some difficulties. So when we think about that, we think about our community, we think about our resources, we think about what we're going to do about that. What happens? Next slide, please. So this is kind of a new term, overdose compassion fatigue. So all of a sudden, we're normalizing deviation, right? It's not normal for someone to overdose. But now we're hearing it so often that we're going, okay, okay. But it's not normal. And we shouldn't normalize that deviation from quality of life and living life. So overdose compassion fatigue, distress resulting from knowledge of or exposure to overdose related harms and that sort of thing. So it's very much fits along with what we're talking about. But the go here is that we're going to recognize that, we're going to be mindful of that, and we're not going to allow that to happen so that's going to interfere with our involvement in getting something done about the opioid epidemic, pandemic situation. Just yesterday, Dr. Sean Ryan, who many of you may know, he's one of the founders, a very patient advocate, and our CMO, Dr. Corey Waller, along with outreach and multiple other folks, met State Representative Kim Moser at the Covington location discussing this very thing. What can we do as a organization, as a state, to lobby and get some things changed so that we can offer additional services in Kentucky that have been proven in other states, but Kentucky isn't including that in their coverage for patients. All right, enough on that. Next slide. Here's starting, what can you do for your staff? And always, what can you do for yourself? So again, being mindful, show them how much you care, how much they're valued. Keep work conditions safe. I know we're getting close on time, but I want to share something that happened over the weekend at one of our clinics, one of our NTPs, OTPs, where we provide methadone. We had a situation where a patient showed some behavior that the staff felt threatened. They immediately notified their medical supervisor, got involved, and dealt with that situation immediately. That patient left. There was some more information gathered, and that medical supervisor got back with that staff and said, if that patient arrives, this is what we're going to do. You're going to not confront that patient. You're going to get that medical supervisor back on the phone so that they can talk to that patient. You're going to call for backup support because we all know we're all concerned as well, about our own safety and our staff's safety. So that medical supervisor, let that staff know immediately that they were cared about. There was some safety workflows put into place, and that staff had something that they could depend on. Living at competitive wages, of course. We want to be market competitive. We want to get compensated for what we do. And we want to encourage those mental health days and rest days. And we want to encourage you to use your time off. And ideally, as opposed to taking a day here and a day there, you want to take at least 5 consecutive days off the whole week so that you've got the weekend and you can really refill that energy bank. You can really take care of yourself. You can really get some things done. Taking a day off and a day here to go to your medical appointment, your dentist appointment, take your dog to the vet. That's not really taking care of you, your emotional bank. Yes, it's taking care of you and yours from that aspect, but you need to rebuild that energy bank. So take care of yourself, utilize those days off. And Rhonda's done a great job about this. Our job is very demanding. Everyone that's listening to this is listening to this for a reason. And we have a difficult job. We deal with sometimes a very inpatient population, very vulnerable population, sometimes manipulation, sometimes all kinds of issues that we deal with. And then we might have to deal with that at home. So in some fashion or another. So recognizing that, and again, giving yourself a little pat on the back, or a colleague or a family member a pat on the back. So we want to see that promoting care seeking is a sign of strength, not of weakness. We don't need to be that stoic first responder, cape on wand all the time. It's okay to reach out. And hopefully the organization is going to offer some resources. And I think we're going to talk about that a little bit later, EAP programs and that sort of thing. So, all right, next slide. Again, what can you do for your staff? You're going to work on that culture. If there's something that you're seeing going on, get involved, foster that teamwork, do some team activities. Communication is key. It's so important. Really, you can't over communicate. Yeah, there's that term TMI. Okay. But in this situation, you really can't over communicate on what's going on. Be active, be a participant, and join in, make yourself noticeable as you walk around. Have ways that the staff can get their points across or concerns across, perhaps in an anonymous fashion, so that they don't feel threatened, even though we say you're not going to have any kind of retribution if you share something. We all know that has happened and possibly could happen, and some people may fear that and hold in a concern because of that. So having that box or that sort of thing, the EAP services, and then be responsive, listen, and most of all, take action and show that you care. Show that you're doing something and communicate that back. So you're taking action, nobody knows it, wasn't really done. Just like when you're doing a documentation, if you didn't document it, it wasn't done. So you take action, put it on paper, you share it, get that outcome, and then show that back. So again, you can't over communicate that. Next slide, please.
Thanks, Cheryl. That's such a great lead in, for this. And I don't know, the more we talk about this topic today, there's so much to say. And so it's definitely a lot of information, but we hope this is helpful to you and just to get you thinking about some things. One of the things I wanted to add here, you don't see on the slide, is just the concept that, we build work into our schedules every day. Obviously, we need to for the purposes of getting by in this world that we live, but just the same, being able to build some healthy strategies in for yourself, even if it's just 15, 30 minutes, it might be 2 5-minute breaks, 2 10-minute breaks. Do something, build that into your day. Just by making that plan, it's showing that you're being intentional on watching out for these things. And that most importantly, you're being intentional on taking care of you. And so, just like Cheryl gave that example of, when we're on the plane, we put the oxygen on ourselves first so we can help others. And so just the same, put that in your plan and your schedule, because that's what you deserve and what you need to keep doing, the things that you're doing and the good work you're doing. And you have to learn to say no. Saying no can be one of the toughest things that we do sometimes, because typically folks in this field, we worry about how that's going to impact others. What will others think? Will it look like I'm not being a team player? Our minds go on and on. But saying no should be able to come out sometimes just the same as saying yes. Limit your screen time. This is a huge one. Ultimately now we live in a world where every free minute that people have, most of the time they're spending a lot of it on their phone, scrolling through social media. Really common to do this before bedtime, I think. I was driving by a bus stop this morning and saw every child out there, on their phone, and just was thinking about this presentation today. So watch how much you're on your phone and how much you're spending time just scrolling through things. If you have work platforms on your phone after hours, chances are if you're spending a lot of time on your phone, you might be glancing over at some of those platforms, kind of limiting that time off. So be mindful of that. Prioritize your sleep. Set yourself up for success by making sleep a priority. Sleep can be tough, but things like just setting up a plan for a range of time that you're going to go to bed, and most importantly, a range of time that you're going to disconnect from, social media, your phones, TV, all of those things, so you have some time to wind down. And then there's physical activity. I had someone, tell me once that if you've got time to watch TV, if you've got time to scroll on your phone, then you've got time to take a walk. You've got time to get some exercise in. And I fully believe that 100%. If you don't feel like you have time for any physical activity, look at your day-to-day, just how you're spending time, and chances are, I guarantee you can build it in somewhere and replace something. Focus on healthy eating. It's no secret that what we put into our bodies is the fuel that we get. And so we want to get good fuel from healthy foods. When we eat junk, right, we end up with not much energy. We feel pretty crummy, and the list goes on and on. So any focus that you can have on eating healthier. And then limiting caffeine consumption, soft drinks, nicotine. Sometimes the busier we get, the more we drink, caffeine, coffee, Cokes, etc. Energy drinks are a big thing, may smoke more, et cetera, et cetera. So limit that as well. As I know Cheryl will certainly be able to speak to, those chemicals do impact your the way your body's feeling, your ability to sleep, your ability to relax, and unfortunately, they make us a little more keyed up as well. There are apps out there.
Rhonda,
Yeah,
I want to throw in there that we
Yeah.
all can do, because we all have our phones. My phone just beeped, and I hope y'all didn't hear that and see me look at it, because that went right in what we're talking about. But so 3 to 5 minutes, a song is about 3 to 5 minutes. If you just play on your phone a song and get up and dance. Of course, turn off the camera if you're doing that sort of thing, or close the door. But that's one thing that you can do. 3 to 5 minutes during that song. Get up, dance, move, and then wow, that makes a huge difference. Okay, keep going.
Yeah. No, thanks for that. And then I would just say there, sometimes when we try to, build things like exercise or healthy eating in, we tend to kind of use an all or nothing mentality. It's like, I have to eat every meal and it be a healthy, prepared meal. That's not the case. Build one meal in a day. one plan starting somewhere is the way for you to develop that process. And you can kind of build some momentum. Same thing goes if you can just listen to a song a couple times a day and take a dance break or a break just to kind of like unwind and take a deep breath, then chances are you're going to feel better from that. And you're going to want to be able to, prioritize that a little more. So just once is enough sometimes to get you started. There are apps like Headspace and Calm if you've not checked those out. They do have some free capabilities with them. They're really neat. I've used both of those myself, and there's a lot of just very simple meditations, deep breathing exercises. Again, they're not things that take 30 minutes, 20 minutes. They're things that take a couple of minutes. And then there are longer ones available, if you do have more time. Again, just building that into your plan can be really helpful. Check those out if you haven't seen those before. And then Cheryl had mentioned, using resources that your company might provide, like the Employee Assistance Program. Those things are out there for a reason. They can be a great resource. So check with your company and take advantage of those if they're available. Not only do they usually offer the ability for some free counseling, but there are lots of other resources and supports that are available in there as well. And then you'll see here the eye movement desensitization reprocessing, big word, EMDR, but that is a helpful a therapeutic technique that's available out there. You'd want to go to a trained professional for that, but certainly if you've been dealing with like burnout and things for a while and you've not taken the chance to talk to a counselor or therapist, would definitely recommend you to check into that. And you may also take advantage of some of these things like EMDR as well. But just talking to someone about it and getting another opinion is a good place to start. Again, just taking that first step. Next slide.
So being in control, and we're getting down to 6 minutes here, and we hope to have some time for questions and answers, but we're going to try to recognize what you're feeling when you're feeling it without judging it as good or bad. Rhonda mentioned this at the very beginning. So there is no good or bad. It's mindful. It's in the moment. What are you feeling? Recognize it. Be aware. Pay attention to that mindset. Now, we made a big point of not being overly positive. However, we all know that positive attitude does give excellent results. What we meant in that earlier on is don't rely on continued positive, when it's not. Don't be that Pollyanna, really be mindful of what's going on. Make a list of the things that cause you action. Pick one of those things, start small, like Rhonda mentioned, and check it off, do something about it, act. Look for sources of stress that you can limit. Rhonda mentioned that quite well, so we'll just shoot over that. And so important to spend time on something that brings you joy. So think about that. So important. Be careful about coping strategies that might make things worse. For example, self-medicating. Alcohol is one of those things. Marijuana, perhaps. Gambling, some of those behaviors that immediately increase the dopamine, immediately make us feel better, but then over time that becomes more of an issue and a problem and actually makes things worse. Nothing more important than connectivity, connectivity with colleagues, family members, community. Again, those relationships that mean something to you. Reach out and make them meaningful. Next slide.
Yeah, we did want to provide you with this resource. If you've not checked this out, this is a great one for you. It's the Professional Quality of Life Scale, short for ProQual. And you'll go to the website there, proqual.org, PROQOL.org, and you'll see that on the slides. But it's a great resource. It essentially will help you kind of see where you're at in terms of compassion fatigue, and it will give you a score based on your responses. And you can see how you're doing on burnout, secondary stress, and then just compassion satisfaction also. So a good way to kind of balance and see how you're doing. And so if you have never used this, we would encourage you to try this after this webinar today. Build this into your plan at some point and do this periodically. You can even share it with your teams. This is a free resource. I did want to mention, if you go to the website, you will have to do a registration, and they do ask that you just, of course, give them the credit, as being the resource where this came from, since this is their compassion scale. Very helpful resource and a good way to get an objective look at kind of how you're doing overall. Next slide. That gap analysis is a helpful tool as well. And so something that you might think about using here, this tool can help you with just looking at where you're at in your current state. So it would be good to do the compassion scale before starting the gap analysis, just to see objectively where you're at. And then that remedial action, what is your desired state? Where would you like to get to? What actions do you need to take to get there? And then what actions could your employer take to help you get there? And that really can help you in, getting to that desired state. But most importantly, it can give you an objective look at just how you're doing with your compassion fatigue, your burnout, and some of those contributing factors. I will say, if you do the compassion scale that was on the previous slide, the ProQual, you will be able to see where you stand and kind of also understand some of the contributing factors, which is really helpful. Sometimes when we're dealing with these things, we don't have a good, a clear head in kind of assessing them. So that can be really helpful. Next slide, please. Yeah, and I know we're close to time. I think we've got a couple of minutes, but Cheryl mentioned, that don't ever forget that the work that you're doing is making a difference. Sometimes we tend to think about, if we are helping others, we're successful when we help them with all the things, and that's not the case. Every little bit makes a difference in that person's life. And so we wanted to share some data with you that we've collected at BrightView. We asked 325 patients anonymously just several questions about their recovery, and these are some of the different responses that we got. I'll call out a few of them. And, all of these are good, so I hate to skip any, but for the sake of time, we'll just look at a few. I would have died without their help. Perfect example of, the work that we're doing is impacting others' lives, but also, keeping them going every day, and keeping them from, anything fatal. I was tired of being tired. I had reached rock bottom, homeless shelter, lost my wife, kids, house, career. I either had to change or die like the rest of my friends. Dying didn't sound like too much fun. So another great, example there. And then I always want to live and have begun to love me. That whole concept of, us loving ourselves is such a huge thing to ever accomplish, and to think about, helping a person in recovery get there is pretty amazing. And so that's all due to all, some of the great work, all of you have done, and each of us, in working with others in healthcare. Next slide. Yeah. Just some last words here. I did want to point out Brene Brown is a great resource. If you enjoy podcasts, she has quite a lengthy podcast series that has a lot of compassion, fatigue, burnout related, just self-help, strategies. She's just got a great way with words. She's experienced a lot of these things herself, has worked in the helping profession for a long time, and so a great expert on the topic. But as she says here, I really like this. I want to point this out. Many of us are willing to extend a helping hand, but we're very reluctant to reach out for help when we need it ourselves. So true, isn't it? We'll encourage others to ask for help over and over, but we fail to do that ourselves. It's as if we've divided the world into those who offer help and those who need help. The truth is that we are both. Need is the most beautiful compact between humans. All of us need something, and so no one is invincible from need, and that comes from Brene Brown. If you've not had a chance to look at her work, check out her website. She's got a lot of good resources and tools on there, and some things that may help you if you're supervising other staff, and giving them some resources as well. And then last but not least on here, if you don't heal the wounds, you will bleed on those who didn't cut you. And that's so true just from this concept of talking through compassion fatigue and burnout. Next slide. I think we've got, we're at time. I didn't know if we wanted to take a few questions or if we had anything that came up in the chat.
Yeah, please, if anybody has a question, we're happy to stay on and answer those. We are obviously at time. I did post links to the slides and the certificate of attendance in the chat, and we want to thank everybody for attending, and obviously thank our speakers, Rhonda and Cheryl, for some really helpful content here. It looks like, let's see, one question that we have is, hang on a sec. As far as somebody that's worried about stigma, you know, should they keep this private? Obviously not, but how can they bring this up? How can they address this if they're worried about the stigma that can be attached to this in certain workplaces?
Yeah, I guess my feedback on that would be, you know, to talk with, you know, your direct supervisor if you feel comfortable talking with them. And if not, a human resources representative at your organization would be a good place to start. And it may be that you'd be more comfortable going to them first. And if that's the case, that would be okay. You know, reaching out to someone's the most important thing.
It's a great point.
Yeah, and I would add to that, remember the EAP, the Employee Assistance Program. So that is a safety net. And I think what that person may be showing is some fearfulness of sharing that information with direct employees, maybe even their direct supervisor. So if you do not feel comfortable with that person, then reach above and beyond to a safety net, and that EAP program would be a way, also anonymously.
EAP is a great point. That is pretty well established resource. We have another question, and Patty's interested to know if this presentation would be recommended for families of those who struggle with substance use disorder, and if not, what direction they should head in to maybe try to help those folks out.
Say this would be very helpful, you know, to those folks for sure. And, you know, the same strategies that we would, you know, we've reviewed here could certainly apply in interacting with someone in your family. And then, you know, to that point, a person doesn't have to be working in a healthcare position to experience compassion fatigue or burnout. It can happen just from your day-to-day responsibilities of, you know, being a caregiver, supporting someone in your family, a friend, you know, any of those situations can qualify. So this could definitely be a good resource for that as well.
And there's also resources for Narcotic Anonymous and families of Alcoholic Anonymous and Al-Anon, for example, you know, groups that support this very thing.
Okay, thank you. Yeah, one last question. What resources are available to create a compassion or quiet room for the workplace?
Yeah, that's a great, wow. We should take that to all of our senior administration. I'm going to do that. So I think that's exactly what we do. We bring that idea up. If you don't have it, wow. And I don't know that I've ever seen a quiet room in a place that I've worked, but shoot, that's a good idea.
It's a great point. I know that some offices have quiet rooms to take like personal phone calls and things, maybe designating one of those, or if you don't have a designated space, simply creating one, I think is a great idea. That's great. That's a great point. And with that, we are at the end of this presentation. But again, we want to thank everybody for joining us. We will be sending links via follow-up to the slides, the certificate, as well as a video of this presentation. And we just want to thank everybody for your time today. Have a great one.